Usually, most men will have a small bend in their penises, especially when they get an erection. This is common. Nobody's penis will be straight and on erection will not be at 90 degrees angle. The angle may change. But this will not produce any problem or difficulty for this man to have a good vaginal penetration and enjoy the sexual life. There will be no pain also. People need not get worried about this small bend or curvature. But if the bend is severe and has difficulty in achieving vaginal penetration and also accompanied by some amount of pain, then diagnosis is a condition called Peyronie's disease. Peyronie's disease is a condition in which a scar tissue is formed in the tissues of the penis. Because there is scarring of the penile tissues, when it contracts, it will make the penis bend. It will also reduce shortening of the penile length by up to half a centimeter. It comes in two conditions, two stages. The first stage is called acute stage, where the bend may be severe and accompanied by severe pain. This stage may last up to 6 to 12 months. Even if left untreated, the pain will go away, but the bend may not rectify. After that, it falls into chronic stage where there is no pain and the scar tissue is not growing inside the penis. So whatever curvature or bend has already occurred will be maintained. Now, what the problem in this? The problem is it will make the penis bend to some direction. And because of the severity of the bend, achieving vaginal penetration becomes difficult. When they touch the penis, they can find hard nodules inside the penises. The diagnosis by a doctor is primarily by physical examination, by touching and feeling the penis and detecting the nodules inside it, and then confirming with penile Doppler, which will document objectively the scar tissue formation in that. Once the scar tissue forms, there will be further calcification and that will increase the size of the scar tissue. Nobody knows why this happens. One theory is there is some amount of injury to the penile tissues and structure sometime or other. Either the man forcibly bends the penis when it is erect, or some hard object has struck his penis, or when a woman comes on top and she forcibly has sex, or the man who is on top suddenly turns over, bends without disengaging, and then allowing the woman to come on top, there is some amount of damage. These are all conjectures. Strictly speaking, none of us will know because this man will never remember what happened some time ago. How do we manage this? Basically, there is no specific treatment for this. As long as there is no pain in the penis when on getting an erection, and the curvature or bend is not that severe and he can achieve penetration, we leave him like that. Doctor may prescribe medicines like L-arginine, tadalafil, etc. to increase the blood flow to the penis so that the scar tissue may slowly resolve. This is experimentally doing. Some people may give some anti-blood pressure drugs also. A drug called isoptin can also help, it was found. The next is, doctor may prescribe L-arginine gel to be applied and massaged on the penis or the area of the nodule. If the pain is severe, the shortening due to bend is very severe, then surgery has to be resorted to. One, they can do surgery to remove the scar tissue and try to lengthen the penis. If that fails, they have to do what is known as a penile implant surgery. So whenever a man has a doubt, best thing for him to consult a specialist in urology, urologist, who will examine the client and take a decision and decide on the appropriate mode of management.